Let's begin with the fourth section of snoring and sleep apnea. And in this section, we will talk about some clinical evaluation that can be done for the person who have sleep apnea or obstructive sleep apnea. History is very important in clinical evaluation. We need to ask the questions to the patient about the sleep apnea or the condition or the features with it, associated with it, if they have any problems with it in the morning. Then also BMI, body mass index, if they are obese or overweight. And collar size is important. Then some systemic examinations are done in clinical evaluation, and also polysomnography, which is recording during the sleep of the person to find out if they have sleep apnea or not. So history is important. Restless, disturbed sleep. Ask the person who have sleep apnea that if they have disturbed sleep at night. Gasping, if gasping is opening of the mouth to get the air in, that's the forceful inhalation to overcome the deficiency of oxygen that occurs with the obstructive sleep apnea. So if they have a history of gasping. Choking or apneic event. Sweating, if they have a history of sweating, excessive daytime sleepiness, fatigue, irritability, morning headaches. If you notice all these symptoms we discussed when we talked about the snoring person, so sleep apnea also have all these symptoms associated with their apnea, and they have a morning headache, sleepless night, daytime sleepiness. They are very irritable because they are tired, they are fatigued, their sleep was not complete. So all these we should ask the person who have obstructive sleep apnea if they have these features in the history. Memory loss and impotence, body position during sleep. If person has the habit of sleeping straight face up or they sleep on the side, we should ask this question in the history also. Use of alcohol, sedative, and caffeine intake should be asked. Mouth breathing, if they breathe from the mouth or they have mouth open during sleep, or if they breathe from the nose. History of menopause or hormone replacement therapy. So all these questions should be asked in the history of the person with the suspected obstructive sleep apnea once until the definitive tests are performed. Body mass index and collar size. Normal body mass index is 18.5 to 24.9. If the person is overweight, they have 25 to 29%, and if the obese, they have 30 to 34.9. So normal body mass index should be between 18.5 to 24.9. If more than 29, 25 to 29, they are overweight, and above 29, they are obese. Collar size should not exceed 42 centimeter in males, 7.5 centimeter in females. So a lot of times when we buy the shirts, usually they have a collar size mentioned. So 42 centimeter should be the collar size of males, or less than that, should not be more than that. It means they have a more weight, or so the collar size should be 42 centimeter in males and 37.5 centimeter in females. If it's more, they should be trying to control the weight. Complete head and neck examination is also important to look for any hypertrophy of the tonsils that can cause obstruction. If there is backward lower jaw retrognathia, that's also important to notice or examine. Macroglossia, look for any enlargement of the tongue. Enlarged tongue can also cause obstruction and cause obstructive sleep apnea. All these findings, we look for them during the clinical physical examination. If there is any on the throat examination, if there is hypertrophy of the tonsils, if the jaw positioning is not right, if there is enlargement of the tongue, if there is elongated soft palate and uvula, that we should do the uvulopalatoplasty, and then the elongated should be cut down to reduce the size to decrease the obstruction. Base of the tongue tumors is another cause that can be looked for. If there is any DNS or deviated nasal septum, the treatment for that is very, very simple. The DNS should be treated. Surgery is done to remove the deviated part, and then the person can feel better. So it's easy treatment for even tonsillectomy is not that hard. Uvuloplasty is easy procedure. Septal deviation treatment is easy. So these are easily treatable causes. Nasal polyps can very easily be treated, but the bad thing about nasal polyps, if they are seasonal polyps, allergy polyps, they usually come back, but they will give the relief for the time period. Turbinate hypertrophy, we can do the turbinectomy for that, and that can relieve the patient condition. Nasal valve collapse can also be treated. Mueller's maneuver, look for collapse of soft tissue at level of base of the tongue and just above the soft palate, and level of pharyngeal obstruction. So in this we look for the collapse of soft tissue that can cause the obstructed sleep apnea at the level of base of the tongue and just above the soft palate, and level of pharyngeal obstruction. This Mueller's maneuver is in which we have the done in which the inhalation and exhalation can be performed forcefully to look for the obstruction. Systemic examination, we have hypertension is usually present in the systemic examination. Heart failure, we mention all these complications like heart failure, angina, respiratory failure, hypertension. So in the systemic examination, we should look for all these features. Pedal edema or swelling of the foot. Truncal obesity is also another feature in which there obesity of the truncal obesity. Hypothyroidism, low thyroid level, cephalometric radiographs should also be performed. Polysomnography is the test done during the sleep. Sensors are placed at the nose to measure the airflow. Wires transmit data to the computer. A technician in nearby room monitors the data. So here the wires are attached to the computer which gives the data. This is the sensor on finger that measures the amount of oxygen in the blood. Elastic belt center around sensors around the chest and belly measure amount of effort to breathe. And this is the sensor in the face and scalp, measure eye movement and brain activity. And this polysomnography gives the indication if the person have obstructive sleep apnea during the sleep. So all these are different tests that can be done to find out, and then different etiological factors should be looked for, and then the one which can be easily treatable like tonsillectomy, uvuloplasty, and treatment of deviated nasal septum, that can be done. So that was all about section 4. Thank you for watching sqadia.com.